Hello, I'm Luke O'Neill and here I am in my lab in the Trinity Biomedical Sciences Institute. So this week on my COVID-19 update, vaccine combinations. Novavax, again a very effective company making vaccines, it must be said. They have done the first test with a flu COVID-19 combination. Isn't that incredible? And we kind of predicted this because it makes sense then maybe in the future to put a COVID vaccine in with a flu vaccine. And they've done it. They've combined a flu vaccine with a COVID-19 vaccine, tested it pre-clinically, which means in animals initially, great antibody response to flu and to COVID-19. A protein called hemagglutinin is in flu, and of course the spike protein is in COVID-19, and they got antibodies to both, a really strong antibody response. And then even more impressively, they tried to infect the animals and they were totally protected. There was no virus infection, either flu or SARS-CoV-2 in the animals given the combination vaccine. Now of course it's early days, but Novavax may well be the first off the blocks here with a combination vaccine, and that's definitely the future for vaccination with COVID-19. And of course, a very important area that we saw very early on was a small number of people get allergies to vaccines. And that was initially a bit of a concern. Of course, it was a good example of pharmacovigilance because these allergic reactions were spotted very early on. And what that means is when you're given the vaccine, you wait maybe 30 minutes to keep an eye on you to make sure an allergy isn't developing. But guess what? It's a really rare event. Huge big analysis, less than 10 cases per million in the Moderna and Pfizer vaccines in particular for people getting allergic reactions. So again, it's nothing really to worry about. And of course, if you have allergies already, that wouldn't necessarily mean you're at increased risk of this. And even if you have, you might have an EpiPen on you, and if an allergy develops in that very rare case, of course, it can now be treated. So again, it looks like as if allergic reactions are nothing to worry about really when it comes to these vaccines. And every day we get new information on the immune system's response to this virus. Papers are coming out every week, almost big publications. And last week, a really important paper came out. They measured antibodies in people with COVID-19 really closely over time and tried to correlate the antibody levels to what sort of disease would emerge, like would severe disease emerge or not. And they saw something very interesting. The big predictor of severe disease and death is a delay in antibodies. So if your immune system can't ramp up antibody production pretty quickly, the virus can begin to get a foothold and begin to harm you. And that turned out to be the biggest predictor. And in particular, a type of T cell called a follicular T helper cell. There's a great mouthful for you. That T cell really helps the immune system to make antibodies. The B cells are the cells that make antibodies. Less of those in these people meant less antibody and then more severe disease. So it turns out for some unknown reason, some people can't mount a proper T cell response. And that response then means less antibodies and then more severe disease can emerge. Now it's important this because it might mean that if you measure antibodies during disease progress, you may try and supplement antibodies quickly, say in people who can't make enough antibodies, for example. But certainly it's really good immunology, learning more and more about the immune system and how it handles this virus. And you can hear about these stories and more on my weekly COVID-19 update with Pat Kenny on Newstar.